Digestive issues, certainly not fun to talk about or even deal with, but a lot of Americans have them. The problem is our diets. Okay, so how can you tell when that upset stomach is something a little more serious? News Channel 8's Stacey Scheibel has an 8 on your side medical report.
About 70 million Americans suffer from digestive disorders every year, and if not properly treated, many of those disorders can lead to very serious conditions. Joining me today is Dr. Sharona Ross with some insight. 70 million Americans, that is a lot of folks out there with stomach trouble. What's causing it?
That is true. What's causing this digestive disorders? Our diet. We eat too much and we eat a lot of fatty food. If we're talking about hamburgers, hot dogs, French fries, we eat cheese and we think it's pretty healthy. Well, it's not, and especially not in the quantities that we consume. Every time we eat something fatty, we may develop gallbladder disease or gallbladder disorders, especially if we have gallstones or gallbladder dysfunction. And what happened is, people like us would eat the wrong food in the wrong amount and then develop this pain because the gallbladder contracts to release the bile, but it contracts against a stone or does not function very well.
How do you know when you need to see a doctor? I mean, what kind of pain are we talking about and where would you feel it?
Yes, so we're talking about when you eat hamburgers and French fries for lunch, right? Which you shouldn't, but let's say you are. Then what happened is you may develop within 30 minutes to 2 hours severe right upper quadrant abdominal pain that may radiate to your back. And it would last for hours. It's not going to go away within minutes. It's going to be there for a long time.
And that's when you know you need to go to the doctor.
That's when you need to go to the doctor, because every time you get those gallbladder attacks, the gallbladder gets sicker and sicker and it'll be more scarred. And a simple operation will become a very big operation.
How common is that? I mean, are a lot of people suffering this?
It is amazing, but this is one of the most common operations in the U.S., cholecystectomy, which we do laparoscopically, removing the gallbladder from the body. And let me tell you, there are no consequences, truly. And so you take the gallbladder out and you're cured.
But then should you change your diet?
Absolutely. You absolutely should change your diet. Nobody should eat the amount of fat that we consume in our American diet.
Yeah, we know that childhood obesity and obesity in general is a big problem. Thank you for your insight. We appreciate it, Dr. Ross. Thanks for joining us today.
Yep.